Well, first of all, I would say that the aim of our study was to make a well-designed study where we either confirmed or refute a potential association between the use of acetaminophen and a later risk of autism in the offspring. And in our study, we saw consistency in all of our results between the different types of methods that we use. And we both used a population level analysis, as you say, and a sibling-matched analysis. The problem with the population level analysis is that there's a reason that a potential association you detect may not be the actual effect of the drug, but rather differences between the groups. As in our study, it would be the exposed women and the unexposed women the ones who have taken acetaminophen and the women who didn't. And the difference you detect could be not the use of the drug, but an underlying health, an underlying health condition, or it could also be another healthcare seeking behavior rather than the actual effect of the drug. Most of the other studies who have seen a potential association in their population level analysis, they didn't see it when they made a sibling-matched analysis. The sibling-matched analysis is usually considered a very strong analysis because here, as in our study, you compare a woman with herself in two different pregnancies. We usually think that the best control is when you control with yourself. The good thing with the sibling-matched analysis is that you here control for shared familial factors, such as pre-genetic disposition and also environmental influences. So when we in our study didn't see any association in any of these methods, it is most likely that the previous detected association in the population level analysis is due to residual confounding and not a direct causal effect of the medication. So yeah, for pediatrician, this means that I think they should put greater weight into the designs of the study, and especially looking at these sibling comparisons, because it's usually considered a very strong analysis. And when you look at the previous studies, they also, most of them conclude when they maybe find a little association in their population level study, they don't find it in the sibling-matched analysis, they conclude that it must be due to residual confounding. Well, some degree of residual confounding can not be fully excluded, not in any kind of this type of studies. But of course, in this type of studies, the most important confounding factors would be confounding by indication. It means what was the actual cause that the woman took this medication? Was it due to a disease causing a fever or pain? And is it actually that disease that causes an association with autism, or is it due to the use of the drug? And then also I would, of course, mention that in our study, we didn't have information about over-the-counter acetaminophen, and that could also be a potential residual confounding factor. I think, first of all, it's important to empathize that earlier studies have only shown small and also inconsistent associations. And we have seen that these associations diminished when they were controlling for confounders. As in our study, we didn't find any association in any of our analysis, which is a strength of our study. And also, the confidence intervals you see in the study is very narrow, which means that even though there were an association, it is most likely to be very small. And so far, I would say the majority of evidence from these studies show that there are no meaningful association between the use of acetaminophen during pregnancy and a later risk of autism in the offspring. Yeah, of course, when we don't have information about over-the-counter acetaminophen, there is a risk that we underestimate the number of women who were exposed. But it would usually be the ones who didn't take a very large amount of the medication. And we know, but it of course will mean that we may misclassify some women who have been exposed as unexposed. But we know from previous, actually Danish, both validation and simulation studies where they have looked at this, the effect of when you don't have information about over-the-counter drugs, and they show that the magnitude of this bias is usually very small. We also, in our study, we looked at the time after 2013 because there was a shift in the number of tablets you could buy over the counter of acetaminophen in 2013, which was reduced, so you were only able to buy 10 tablets at a time. And when we look at the period after that time, we also didn't see any association. Well, acetaminophen is an important first-line analgesic due to a very low safety profile, and that's also in pregnancy. And I would say that our findings support the body of evidence of these studies that there are no clinically meaningful association between the use of acetaminophen during pregnancy and a later risk of autism for the offspring. So our studies support that acetaminophen is still a drug with a low safety profile also for women.